Now we have Dr. GREESHMA MERIN Sebastian to speak on to evaluate the risk factors of retinal vein occlusion, a retrospective study.
Good morning. My topic is evaluation of the risk factors of retinal vein occlusion in South Indian population. Introduction. Among the retinal vascular diseases, the most common is diabetic retinopathy and the second most common is retinal vein occlusion. The most common associations of retinal vein occlusions are hypertension, diabetes and atherosclerosis. Other associations are inflammatory, infectious and hematologic disorders. And it provides a unique opportunity for ophthalmologists to contribute to the patient's medical care. Most of the reported literature are from Western countries. Our Indian subcontinent has limited number of literature. Aim of the study to evaluate risk factors of patients who presented with retinal vein occlusions in a tertiary eye hospital in Kerala, South India. The study design is hospital-based chart review, and the study population is all patients who are diagnosed with retinal vein occlusion, and the study duration is from January 2021 to December 2023 at a tertiary care center, South India. So, out of all the retinal vein occlusion patients has been divided into two groups, that is group A who constitutes more than 50 years of age and group B who are having less than or equal to 50 years of age, and each of these groups were divided again subdivided into central retinal vein occlusion, branch retinal vein occlusion and tributary vein occlusion. Known risk factors at presentation were recorded and others were investigated for risk factors and noted. Inclusion criteria: all patients diagnosed with retinal vein occlusion with at least one follow-up visit. Exclusion criteria are the patients diagnosed with retinal vein occlusion without any follow-up visit. So the risk factors includes both systemic and ocular. Systemic risk factors are systemic hypertension, diabetes mellitus, hypercholesterolemia and homocystinemia. Ocular risk factors includes glaucoma and hypermetropia. Coming to results, total number of eyes taken were 615, and it was noted that 90% of the retinal vein occlusion occurred in group A, that is more than 50 years of age group, and 10% occurred in group B, that is younger patients. Coming to distribution of retinal vein occlusion, in group A, that is more than 50 years of age patients, 35% had CRVO, 61% had BRVO and 4% had TVO. In group B, that is in younger patients, 42% had CRVO, 58% had BRVO and none of them presented with tributary vein occlusion. So in risk factors in central retinal vein occlusion, in both groups A and B, the most common were hypertension, diabetes and glaucoma, followed by dyslipidemia, then hypermetropia and homocystinemia, and in group B, that is younger population, hypermetropia was not found as a risk factor. In coming to BRVO, the most common risk factors were hypertension, diabetes, dyslipidemia, then glaucoma and hypermetropia. Homocystinemia was not found as a risk factor in both the groups in BRVO. Coming to tributary vein occlusion, only group A presented with tributary vein occlusion to us, and here the most common risk factors were hypertension, diabetes, dyslipidemia and glaucoma. None of them had homocystinemia and hypermetropia as risk factor. And coming to the multiple risk factors, 84% of the group A and 61% of the group B had multiple risk factors, 16% of group A and 39% of group B had isolated risk factors. So this study was conducted to find out the common risk factors and systemic and ocular associations of retinal vein occlusion in a tertiary care center in South India. In this study, majority of the study population belonged to the age group of more than 50 years, which accounted for around 90%, which indicated that the prevalence of retinal vein occlusion increases with age. Coming to literature, Beaver Dam eye study by Klein et al. And the study population taken were CRVO and BRVO. They concluded that the common risk factors were hypertension, pulse pressure and diabetes mellitus. And another study in Italian population by Edoardo et al. Concluded that age, smoking and diabetes mellitus are the common risk factors in a group of CRVO. Meta-analysis done by Peter Kohler in a population of CRVO and BRVO concluded advanced age, hypertension and diabetes mellitus as the common risk factors. And another study from India, that is from Surat, Gujarat, India by Kushnuth et al. Concluded that hypertension, dyslipidemia and homocystinemia are the most common risk factors, and the type of RVO taken was BRVO. Our study, which was done at a tertiary care center, South India, and we had the subpopulation of CRVO, BRVO and tributary vein occlusion, concluded that the common risk factors were age, hypertension, diabetes mellitus and dyslipidemia. The group B with young patients also had similar risk factors as of group A. Risk factors suggestive of hypercoagulable states on investigation were not found in group B. In age group of less than 50 years, no patients of tributary vein occlusion presented to us. Isolated risk factors accounted to few. Majority had multiple risk factors. The number of patients having isolated hypertension and diabetes mellitus as risk factors accounted to 6.9%. And additionally, hypermetropia as a risk factor was seen, and it accounted as a risk factor in 4.3% of the patients, and that too mostly it was seen in younger population, that is group B. So strength of the study was other South Indian studies are limited, and limitations are it is a retrospective chart review, so possibility of incomplete data, and couldn't identify patients with systemic risk factors presented to ophthalmologists for the first time. Coming to conclusion, in our study also advanced age was an important risk factor. Other than age, the most common risk factors were hypertension and diabetes in both the age groups. Homocystinemia was not found to be a major risk factor. Hypermetropia as a risk factor was present in a few patients, mostly in group B. So I extend my sincere gratitude to all my consultants and the institution and all the people who helped in their collection of data. Thank you.
You already told that glaucoma also one of the reasons, but in the
that was-
conclusion you have not shown.
That was only in one group,
But
CRVO
glaucoma,
group.
usually whenever see CRV occlusion, you are supposed to rule out glaucoma, open angle glaucoma particularly. You told now tributary vein occlusion. Which tributary was affected more in your study? Which is draining macula, something like that?
Draining macula, draining the macular area.
You have not taken photographs or all?
No, sir.
Okay. You told now atherosclerosis. Atherosclerosis, which part of the retina is affected? You know that? So for fun, this is only, don't take it seriously. You know one thing, atherosclerosis will never be seen in retina. Please remember this.